Tooth whitening, or bleaching as we call it, is where you get your teeth to look lighter, and there's a big demand for having white teeth. As a matter of fact, a lot of the images that people see in magazines now have been photoshopped, and consequently their teeth are really super white, and everyone wants super white teeth. And they don't want to go to the expense of putting porcelain on your front teeth because that's very expensive. So let's have a little bit of think about bleaching. What's actually happening? Well, you've got large molecules in your teeth which are cyclic carbon ring molecules, and when you bleach them, you're basically using hydrogen peroxide to break those larger molecules down into smaller molecules, and because they're smaller molecules, the tooth becomes lighter. A lot of the advertising about getting your teeth whitened or bleached leads the patient to the misconception that they'll actually get a really significant change in the colour of their teeth, and some of that is not true. I've been bleaching teeth since 1988, and it works in some cases and it doesn't work in others. But I'll tell you where it does work. If your teeth are already light and you're young, your teeth go quite white, right? They get quite lighter. If you're an elderly patient and your teeth are very yellow, you'll really hardly notice the difference, because at that stage a lot of the enamel is gone, and you can bleach or whiten your teeth as long as you can, and you probably won't get a lot of change. So if you're going to do it when you're younger. Certainly around about the age of 20 or 18 is a good time to do it. That way the pulp in the middle of the tooth is not as large as it is when the tooth is fully formed, early formed. So you don't want to be bleaching when you're 16 years of age, because the pulp chamber is too large and you'll get a lot of sensitivity. The other thing too is if you've got grey teeth, that's actually due to light transferring through the tooth. So if you bleach them, sometimes the tooth can actually go greyer. The shade that it works is with teeth that are yellowish, right? They're the ones that bleaching works most of all. So you have to see your dentist, have a consultation, have a good look at your teeth, see if you've got any stained fillings that can be removed. But does bleaching or whitening work? Yes, it does. Does it always give you the result that you think you might want to get? No, it doesn't. And that's why you've got to approach each case individually and have a talk to your dentist about it.